Hello and welcome to a new episode of Your Health Podcast. My name is Jan Klusáček and our guest today is Dr. David Eberhard, Swedish psychiatrist and writer and lecturer. Welcome, David.
Thank you.
Dr. Eberhard is focused on the perception of psychiatric risks. He actually wrote a book called In the Land of Security Junkies, where he introduced the term National Panic Syndrome. So, maybe you could tell us a few words about that book and National Panic Syndrome.
Well, it's a book. It was published in 2006 and republished in Sweden in 2021. It's about what I call the Security Junkies syndrome or the National Panic Syndrome. The Security Junkie syndrome meaning that the more safety we seek, the more insecure we are feeling, so to speak. The better we have, the more time and effort we take on our self, our own anxiousness, and what we see over the last generations where people really are safer than they have ever been before is that they are feeling more depressed, get more anxiety syndromes, and act, I would say, seek more. They have higher expectations on life, so they get disappointed more easily. That's about and how the society, if you focus on the National Panic Syndrome, is how the society follows this trend and sort of instead of raising the demands on the people living in the society, they are following this as a codependent. The society becomes codependent, and the more the people are crying for more and more safety, the society follows and gives them more safety when they really are. That may be not the best way to deal with it, because it's what we call in psychiatry, what we see with individuals and always seen is that the more safety you give, you get hospitalized patients, meaning that patients are sort of dependent on being taken care of. It's sort of a victim society where people you win a lot by becoming a victim instead of having an own rationale and making your own decisions. You put the decisions to someone else, in this case the society.
And what is your solution to this problem?
It's a difficult problem because, as people know, if you have the possibility, if you're a parent, if you have the possibility to give everything you've got to your kids, you are going to do it. So and sort of a evolutionary. There's no. If you go back in time, you sort of the persons that did not seek security, they failed to live in if you go thousands of years back in time, it's sort of evolutionary, built in our system to seek security. So you have to in some way go against what you may feel is the best for everyone. If you talk about it when it comes to upbringing, I wrote a book 2013 which called is How Children Took Power, which is sort of the problem is from childhood and on, that if you can give everything to your kid, you will do that, and that will be a permissive upbringing. But I don't know if you're familiar with the economist Nicholas Nassim Taleb,
of course,
who coined the phrase anti-fragile. He coined that phrase when it came to economic systems, that the opposite of being fragile is not actually being robust, but rather being anti-fragile. That is, if you have a glass and you smash it in the wall, it's going to break. It's fragile. If you have something made of metal and you throw it in the wall, it will not break, so it's robust. But something that is anti-fragile will be stronger if you throw it in the wall. So that's the opposite of fragile.
Yeah.
And when various aspects of upbringing and is rather anti-fragile than fragile. Even though that said, obviously, if you have a very traumatic childhood, that's not going to be good for you. But meeting difficulties will make you anti-fragile, because that various aspects of our psychology when it comes as human beings are just like the immune system. It's anti-fragile. Some parts of economic system, like Taleb wrote about, is anti-fragile, and that is the case also with upbringing, with socialization and other things that you need to have. You It's not going to be beneficial for your kids to get everything they point at. And since we've had now, at least in Sweden, 2 generations in a row, it's not one generation, 2 generations in a row where both generations have no difficulties whatsoever. So they get really high expectations on life, and that's going to be harmful for them. So I would say the solution to that problem is being aware of being aware of it, and talk about it, and sort of that the society should not be codependent on this security junkie syndrome that the inhabitants may have.
Well, don't you think that it's at least partially part of a nature of a democratic society and of a citizen in a democratic society, when we turned the approach to the government, that the government is no more our ruler, but the government is employed by us, the citizens,
Yes.
in order to take care of issues that are better dealt with on a national level. So then we obviously expect the government to somehow erase all the risks, to ban everything that could be harmful, and to just make our life somewhat easy and safe.
Yes, that is actually what I'm saying.
Yes.
It's part of our evolution, and I'm quoting Winston Churchill that said something like, "The democracy is the best of all lousy ways of ruling." So I'm not saying that we should not have democracy, because obviously that's an extremely powerful and the most the best way. But knowing this, I think part of it is, if you follow every demand, that people are seeking this, the ones that are supposed to govern should be aware that it's not always the best to follow this. The problem is built into the system, obviously, because if you are leading the society, and you do something that is not very popular among the inhabitants, they won't elect you again. But I think still, the best way to treat this is to know about it, and if we have leaders that can explain that to the inhabitants, that the best for the inhabitants is not always going to seek more and more and more security.
Well, you are not only psychiatrist and writer, but you are actually my colleague as well, because you have your own podcast called Health for the Unhealthy, if I'm correct. And what I understand is that you discuss best practices in addiction treatment. So my question is, what about your guests? What is your experience with your guests? Do they really understand connection of between addictions and this too safe society?
If there is a connection when it comes to the too safe society, uh, that's a tricky one. But what we can see is, as I said, that with the too safe society, I'm not saying it's a causal factor, but what we see in a lot of Western societies today is that we have a race of people that are subjectively, I would say, saying that they have bad health, bad psychiatric health, and that is mainly depression and anxiety syndromes, not like psychiatric illness like schizophrenia, etc. You don't see that, but you see it when it comes to depression and anxiety syndromes. And what you also see and what we know is that you have a connection between people having difficulties concerning different addictions when they are depressed, when they are anxious. So we have a codependence between psychiatric problems and different kinds of addiction. So in that way, you could say that you may see higher, at least what you see is among the citizens that do have these problems, they have larger problems with different types of drugs and alcohol and tobacco use, etc.
Well, we've seen sharp rise in visibility of mental health and mental health issues during the pandemic time. If I'm correct, at least in Czech Republic, it was definitely so. But I think, and it's a good thing that the visibility of this topic is still pretty much on even after the COVID and with the current geopolitical situation, etc. A lot of especially young people feel that there is mental health care is an important thing and important government task. So, do you agree with me on that?
I agree that it's a very important task to see to it that the citizens are feeling do not suffer from treatable psychiatric diseases or illnesses or syndromes or whatever you call them, and also it's important to be aware of different addictions, and that the government do have that responsibility to look into to whatever they can do to treat this in the best way, the most efficient way. But what I do think you need to take into account is that uh, when it comes to psychiatric syndromes, they are normally distributed. They are all the psychiatric syndromes are what we call symptom based. That is, you do not have any tests that say that you have either none, some kind of syndrome. But what we do when we diagnose this is that we we um, we look at symptoms over time, and we look at function deficits, and we say, okay, this is a syndrome. This may be helpful to treat in with CBT as a cognitive behavioral therapy, or this may be good to treat with pharmaceutical compounds of different kind. But what we do need to know is that since they are symptom based, and since these syndromes are normally symptoms that you need to have the syndrome are normally distributed in the society. You do need to set up a proper cutoff line for what is a psychiatric syndrome and what is part of life. And I think when it comes to part of life, that you have difficulties in life and you feel distressed, you feel depressed, you feel anxious, that is not up to the government. That is something that I do think former societies they took care of that in a better way with civil society, taking friends, helping each other, and I think you do need to raise the issue when it comes to why do we have religion. Religion takes care of many have been doing, at least, and in Sweden, which is one of the most secular societies in the world, I think parts of that is good. We don't believe in fairy tales, but the part that is not that good is that I do think you need to raise the question: why do we have religion? What is the purpose of it? Why do all societies, all cultures have religion? They need to have sort of a meaning of life. And if you go back in time, the church or whatever religion you had, they took care of a lot of these issues, and we don't have that today. And I don't think that the government or the society as a sort of structure is able to take care of that in a good part, because then if that would be part of the healthcare system, as we that is what is happening now, that the healthcare system are taking the place of the churches. And if you should do that, you need so much money, so you can't treat cancer, you can't treat heart attacks, because you need so much money to take care of that. So you need to find another way to take care of it, I think.
So instead of speaking to your priest or rabbi, people simply go to their psychiatrist. Am I right?
No, they don't even go to the psychiatrist, because they go to the general practitioner, and the general practitioner has no possibility, because they have 10 minutes for each patient.
Yeah.
So that's a problem. I think you need to have some way of taking care of the, if you take this normal distribution curve, and the ones that are close to the middle, that do not suffer from really treatable psychiatric syndromes, but rather having difficulties in life, they need to find other ways. We need to find other ways to take care of that.
Well, let's circle back a little bit to the addiction topic, because we speak quite a lot in this podcast about addictions. And well, I know that you wrote ideology, not science, often dictates the decisions that all of us ultimately have to live by. So, if I understand it correctly, you say that policymakers being surrounded by experts and evidence sometimes act irrationally in an area that is so scientific as health and healthcare. Why is it so?
Why is it so, or is it so? I can answer both questions. Yeah, I would say it is so. I would say that policymakers are often the reason why you get into politics, whether you're a professional politician or a pundit or someone who writes policies, is that you have an ideology, and the ideology is sort of the main force why you want to address a certain issue. So I think it's very it's hard to get around that, because that's why you are interested in the first place. But so having that said, that may lead to especially when it comes to things like addiction, where the scientific evidence is totally different from the policymakers' what they want, so to speak, then we have a problem because, and that I've been writing a lot about since I'm have been working for the last 5 years in an addiction clinic, and seeing what this policy does to people with a dependence and people without a dependence that we also have to take into account naturally.
Do you think that the same situation applies to alcohol as well as tobacco as well as illegal drugs, or are there some differences?
I think when it comes to ideology, I think the same applies. Maybe it's more pronounced when it comes to illegal drugs because they are illegal. but it's the same. It's sort of ideology that are the main reasons, and I do understand that many people that have been doing a lot of very good work when it comes to like treating alcohol dependence, or for that matter, dependence of illegal drugs, are very what do you say? They have an ideology, and the ideology is that you should never touch any alcohol, you should never touch any drug, you should never sort of and this, when it comes to 12-step program, which also, by the way, I think it has good scientific evidence, but I think the reason why it has good scientific evidence is because it is a way to it's sort of religiously driven. I'm not saying that you need to become religious to take part in 12-step program, but you need to sort of take you need to think about the meaning of life. You need to think about those issues that religion tries to solve, and I will say that program has great scientific evidence, and I think so sometimes ideology may be a good thing, because I don't think we would have had 12-step program without these people that are really, they may have been dependent themselves, or have friends that used to be dependent, and destroyed their lives, and they found this sort of epiphany when they came to 12-step program, and that's a good thing. But I think at the same time we need to look at it from all different angles, from biological angles, from psychological angles, from societal angles, and see what do we know scientifically, and we know a lot of things, which I don't think, other things than that that we do not. Our policymakers, when they become very ideological, they tend to get sudden deafness when it comes to that.
Well, you mentioned the 12-step program, and definitely that's true. But on the other side, 12-step program works for people who are at least to a certain extent internally motivated. It doesn't work as a government program, as a government
that's
prohibition.
What I meant.
That's
what I meant.
So why is it that governments are trying to increase measures to make it harder to buy alcohol, to limit advertisements, etc., but it doesn't?
I think
really work.
Yeah, but if you allow me, it's like just if we can just stay on the 12-step program. It's like 12-step program is really it works really well if you have destroyed your life because you have taken drugs or drinking alcohol, and you destroy your life. It works really well. It's sort of it's like a treatment against cancer. Treatment against cancer is really good if you have cancer, but you should not take treatment against cancer if you have a cold.
Brilliant. Yeah.
So that's the problem, because if you derive from the good results from 12-step program and you derive it into, oh, that's the way we're going to treat everybody, then you have a problem.
Yeah, that's really good observation. Well, let's move to something more optimistic. Sweden is recognized as a country with the lowest, not only one of the most atheistic countries, but also country with a very low smoking prevalence and one of the lowest in EU. So, what are the reasons for that? How is that possible? Snus. That's a very brief answer.
Yeah, no, but that's really interesting because when it comes to policymakers in Sweden, they don't recognize this at all. They say this is due to some kind of, you banned smoking outside in restaurants and you banned this and you banned this, but you have been doing that all over EU. So you can't say that is the difference. The difference you see with Sweden against other EU countries and other countries in the world is snus. And if you look at the tobacco consumption in Sweden, it's the same as in the rest of the EU, but smoking is really low. I think we're under 5% now, regular smokers, which is extremely low. And the main reason I would say is that we've had snus in Sweden for hundreds of years, but it used to be, quite messy. It was sort of railway workers or tattooed criminals that were really male sort of it was, to be honest, quite disgusting. I think the most brilliant thing is when they packed snus into bags.
Mm-hmm.
So people started using it instead of smoking, because you can say whatever you want regarding snus, or nicotine, and that's what the policymakers are saying. Oh, nicotine is really dangerous, but nicotine is not more dangerous than caffeine. But the dangerous part is when you heat tobacco up and you draw it into your lungs, or maybe like dipping. Like the problem, you have some scientific results when it comes to dipping, which is very similar to snus. But the difference between dipping is that you have done with the tobacco before you chew it and put it in your mouth. It is heated up and it's sort of burned before. That is not the case with snus. So if you snus, it seems we have a lot of studies on snus, and you can't see oral cancer raising. You can't see any very obviously it raises the blood pressure a little bit, but not more than caffeine. So I think what we should do is to recognize that this is the reason why we have so low amount of smokers in Sweden. It's probably, obviously it's good that you banned smoking in restaurants, etc. That may have helped a little bit, but it is nothing that differs Sweden from any other EU country.
So do you think that this could serve as an inspiration for other EU countries and EU as a whole? Obviously, without the long tradition of Swedish snus consumption, it wouldn't be like the very same product could be used everywhere. But maybe we could spend a little more time looking into other alternative products that could be offered to our
like nicotine pouches that we have without tobacco, which is even better, I think, because it's that you don't even have. Tobacco is sort of disgusting. You don't have that with the tobacco, with the nicotine pouches that are tobacco free. The main problem is that snus was banned in the EU, and the reason I'm not a politician, but the reason, as from what I've understand it, is that the tobacco companies at the time were lobbying a lot that this was sort of not bad for selling cigarettes, and so they actually they succeeded in banning a product that were much healthier than cigarettes, but not banning cigarettes. But now we have the nicotine pouches, and from what I understand, this is out of a there's discussions regarding it, and I hope that the EU will understand the potential of these products when it comes to getting people to quit smoking.
Oh, that is definitely an optimistic point. So maybe it already answered my favorite question that I'm trying to ask all of my guests. So, if you were to become EU dictator for a day and you had the opportunity to implement one measure, what would that be? I mean, in your line of work.
I need to think. That's a huge question. I need to implement something that has huge impact on different levels. Then, so I would have the dictate saying that it's not up to the EU or any government to dictate or prohibit scientifically proven methods of countering drug, alcohol, or tobacco dependence.
Wow.
I don't know if you understood that.
That's I think that is more than one measure, but definitely that is a great answer.
I had one. Yeah. I put it into the
yeah. I see your point. So thank you very much, Dr. Eberhard. It was great having you here, and let's hope that EU sees Swedish experience as something that could be a source of inspiration for the regulation on the whole European level.
Yeah, let's hope so. And it has not been due to the politicians that we see this. I must be very clear on that. The politicians have done everything to counteract that. But even though we do have politicians that want to prohibit everything, we do see this good effect when it comes to at least tobacco. We don't see the same when it comes to illegal drugs, though. We have the highest mortality rate in the EU when it comes to narcotics, and I do think that has to do with our legislation.
Okay, thank you very much.
Thank you.